Hello everybody, thank you for joining me for another episode of Ask Dr. Bob. And today we're going to have a lot of fun. We have tremendous questions. But last week I told you we'd be talking about improving your memory, Alzheimer's, dementia. I wanted to share with you what I've learned. I have our patients do mineral tissue analysis. We take hair from the back of their neck, send it to a lab out in Arizona. I just did a phone consultation with a woman the other day. Her adrenal glands were exhausted. It shows up on a hair analysis with low sodium and low potassium. But what I have learned, because we also take patients' blood pressure, her aluminum was sky high. So I believe what I'm seeing is when you have stressed adrenal glands, your body's not able to process and move all the unwanted, unnecessary toxic minerals like aluminum out. Now, also what we do in our practice, two things. We do something called an essential fatty acid blood spot test, where we prick your little finger and we put it on a blotter. We send that blood to a lab in Georgia, and they'll tell us the DHA fat in your brain that has everything to do with memory and behavior health. You know, we talked about ADHD last week. I'd encourage you to go back and look at our ADHD video clips. So marine oil, we use an anchovy and a sardine-based oil, and also we encourage flax oil. Now, one of the things, and we could talk to you about this forever, about oil, if you take flax oil and you don't have enough zinc in your body, that flax oil cannot be DHA in your brain. What takes zinc out of the body? Bread, soy, wheat. One last concept when it comes to memory, coconut oil. I use 2 tablespoons of coconut oil every day. So much research on coconut oil and Alzheimer's and dementia. Recap, the adrenal glands could be tired and exhausted. High aluminum, not the right kind of oil, use coconut oil. I would also either use 1 tablespoon of flax oil per day per 100 pounds, or a teaspoon or 2 of what we call bio omega-3 anchovy and sardine oil. And I also use coconut oil. Now, Dr. Bob, is there anything I can do to prevent further vision loss? My optometrist mentioned I have an astigmatism. Is it a diet and habit-related problem or genetic problem? I was wondering if you could give me some advice and vitamins. Well, first I want you to know this. We've also spoken in the past at Ask Dr. Bob about macular degeneration. Your body needs cruciferous vegetables for that. And avoid aspirin, because aspirin affects the back of your retina. I also had a conversation with someone the other day that we did a consultation with that had little floaters in front of her eyes called vitreous floaters, which are actually due to a lack of vitamin A, and carrots help that. Now, I also have astigmatism, and my eyes have stayed the same for the last 10 or 15 years. And I don't have to wear bifocals, and I'm nearly 60 years old. But what I have done along the way is, and I'm going to close my eyes, or I want you to watch what I'm going to do. You take your thumb like this, and you start focusing on that, and you go back and forth. So you start training and working on those muscles, and then you can do your eyes like this, in a clockwise and a counterclockwise, and then you can go left, right, all the way around the horn. Focus in and out, around the horn, back the other way, look at your nose, start doing some eye exercises. I know it look kind of weird, but I'm just trying to help. That's why you guys have these Ask Dr. Bobs, right? Fatty tumors. Somebody asked me about fatty tumors. What can I do about them? I want you to know that it has to do with your liver. Your liver is the oil filter in your body. And how do you know if your liver is compromised? Do you have varicose veins, spider veins, hemorrhoids? Those are body signals for compromised liver function. Little red bumps on your body. Do you have these little, they're called xanthomas right here in the lower part of your eye? That's all fat. It's your liver, liver, liver. And if you had your gallbladder out, that is not good. Having your gallbladder out, it's like them taking out your bottle of dish detergent, because your gallbladder is your reservoir of bile, and bile is your dish detergent in your body that's made by the liver to break down the fat. Sugar becomes fat in your body. Liver, liver, liver. What do you do about it? Milk thistle, great herb. I personally take 5 drops of dandelion root every day, and I of course eat the ever famous Dr. Bob's ABCs, a half a red apple every day, 1/3 cup of beets, organic preferred, and 1 medium carrot. I'm trying to get away from the baby carrots because of the whole chlorine soaking That's one of the reasons that we started talking about the one medium care. I noticed so this is the same person with the fatty tumors, I noticed them after I had my hips replaced. So I want you to know, I have a degree in spinal engineering, and we have found something in our practice. Individuals who come in whose pelvis is very anterior, it's like forward, like their hind end tend to stick out, have what we call an anterior sacrum, an anterior pelvis. I want you to know, because Dr. Anthony and Dr. Case and DeMaria have joined my practice, I have learned so much from them. We see this pattern. People who have hip replacements always have an anterior pelvis. So whoever you are watching this right now, if we would have known, if you would have came to see someone like us, we could have helped prevent you from having both hips replaced. But if you have one, if someone is watching us right now and they had one hip replaced, or you know someone has had one hip replaced, before they get hip number 2, you need to come to see us at CLE. Just Google Dr. Bob DeMaria. How can I stop allergies? Very simple. Minimize dairy, eliminate gluten, minimize or eliminate peanut butter. Those undigested proteins go through your colon and create a sensitivity in your body. So this time of year, no peanut butter, use almond butter. No dairy, use coconut milk. Okay? It's really important. Instead of using gluten grains, maybe do some brown rice. I don't promote gluten-free food because it usually has other chemicals in there, including maltodextrin, which comes from corn, has sugar. I would rather have you go to the store and buy food that says nothing about gluten. Vegetables have no gluten in them. Avoid gluten-free food. Just buy food that you know doesn't have gluten in it. Last question, diabetes. You know, it's the 3rd biggest killer. There was just a huge report in the USA Today about this the other day. 95% of diabetes can be prevented by diet and lifestyle alone. You need to lose weight. Most people who are diabetics are overweight. Not all overweight people become diabetics. Metformin and some of these other blood sugar drugs that they give everybody, we use a product called Bioglycozyme Forte, but you need to be exercising. You need to say no to sugar. If you love sugar and you crave it passionately, chromium, C-arzyme is what we use. C-arzyme, really important. Next week, we're going to talk about men's health and the prostate gland and why you're having so many nighttime urination situations that you're peeing a lot during the night. First, I want you to know I appreciate every one of you being on. We just love making a difference in your lives. Please pass this information on. We look forward to speaking with you next week, and please send us your questions. We'll do our very best to get the answer.